Science. I'm Lee-Spiegel.
And I'm Iris-Lee.
And today we're here to talk to you about a rare but potentially career or even life-ending injury.
Broken ankles, legs, and arms are all common sports injuries and ones that are fairly routine. However, did you know that it's possible to break your back?
Well, more specifically, it's possible to fracture a vertebrae. This is a very different injury from a broken extremity. A fractured or even dislocated vertebrae can cause pinching of the spinal nerve and or spinal cord, which could have serious and lasting effects.
Depending on the seriousness of the injury, one could experience pain, difficulty walking, or even partial paralysis. Of course, you can see why this is such a frightening injury for athletes. This was experienced by Brazilian soccer superstar Neymar Jr. on July 4, 2014. His injury occurred during the 2014 World Cup quarterfinal game against Colombia. Neymar was kneed in the lower back by Colombian defender Juan Zuniga and fell to the ground, writhing in pain and in tears.
Neymar was carted off the field in a stretcher and then helicoptered out of the arena and to Hospital São Carlos in Fortaleza. Team doctor Rodrigo Lasmar told reporters after the game that Neymar suffered a fracture in the third lumbar vertebrae of his back. He stated that Neymar would not be able to play in the semifinals or finals should the team qualify.
Lasmar also said that Neymar's injury, quote, is not so serious that he'll need surgery, but it's painful and his back will need to be immobilized. Neymar's recovery was predicted to take a minimum of 6 weeks.
Now, the fracture that Neymar received is known as a thoracic compression fracture, which is a type of vertebral compression fracture. This is when a bone in the spine collapses. Although the bones or vertebrae that make up your spine are very strong, they are still susceptible to damage just like any other bone in your body.
Vertebrae fractures are usually caused by a very hard fall, excessive pressure, which is in Neymar's case, or osteoporosis. These fractures happen most commonly in the thoracic spine, which is the middle portion of the spine.
The human back is like this pencil. If you place pressure on it, it'll bend a little bit, but it will go back to where it was before the pressure was placed on it. However, if you bend the pencil too much, place too much pressure, it'll break. Fracturing becomes more likely when the spine bends forward at the same time that downward pressure is applied, which is exactly what happened in Neymar's case.
It takes somewhere between 3,300 and 4,000 newtons to fracture a human bone, and while the exact amount of force needed to fracture a vertebrae has not been measured, it is expected that the force needed to fracture one is somewhere in that range. After the actual fracture occurs, the individual will feel immediate, severe, excruciating pain in their back, arms, and legs. These symptoms will be extremely obvious, and any individual experiencing these symptoms should immediately see a medical professional to diagnose the situation. The medical professional will then determine the course of treatment.
The most common treatments of a vertebral compression fracture are bracing using an orthosis, pain medications, decreasing activity, and avoiding strenuous activity such as sports. In rare cases, surgery may be necessary. Neymar's treatment plan is said to include 3 weeks of treatment followed by a month-long therapy.
Thoracic compression fractures, or vertebral fractures in general, are not uncommon in the world of sports. An accident that causes the vertebrae to break can also damage the spinal cord. When the spinal cord is damaged, it could lead to paralysis and nerve cell damage. Therefore, it is important that players take measures to prevent these fractures from occurring.
Thoracic compression fractures can even happen to athletes in high school. Here's what trainer Jen has to say about these fractures.
Hi, we're here with TJ. What would you suggest to an athlete with a fractured vertebrae or generally in your back?
When an athlete comes to us and is complaining of back pain, we'll do palpation, make sure it's not stemming from maybe the musculature. But if they have pain along the spine and we suspect maybe a fracture, we have to refer out. That's out of our specialty. And one of the good things as athletic trainers, you have to know what you don't know. You know, if it's not your specialty, we don't have access to an x-ray machine, which is something when they're complaining of pain right along the spine is we need to rule out any fracture. So when we, suspect a fracture, we send right to a physician. If it's a fractured vertebrae and, we may not want to move it, so we might have to stabilize them. So it might be something as like spine boarding them, and then they're maybe in an ambulance to go to the hospital. If they're mobile and they're able to walk and it's something we're not considering life-threatening, then maybe we'll just refer to a doctor.
So would you know how long it would take for the athlete to get back on the field?
It's tough. It depends really how bad the fracture is, where the fracture on that vertebrae is. So it could be anywhere from a month to 2 months, and in some cases, their athletic career may be over, unfortunately.
Só queria dizer que eu vou voltar o mais rápido possível, quanto menos esperarem, eu estou de volta. Queria agradecer a todo o apoio, todo o carinho que tiveram por mim. Valeu, obrigado a todos, um abraço.
La cerveza y el tequila y tu boca con la mía, ya no puedo más.